Hi, my name is Dr. Leila Doolittle. I am going to tell you just a little bit about myself and about how I practice. And one of the things that I really focus on is functional neurology. I also put a big emphasis on functional medicine, and I am a doctor of chiropractic. So, with functional medicine, it is crucial for us to have all the right nutrition coming in for all of our different metabolic pathways, all of the various functions within each different organ system. I know that that is one of the things that we all understand in a certain way, but the brain is dependent on it. Our detoxification pathways are dependent on it. All of the nutrition really just fuels those sources, those powerhouses of information that goes in to these different organ systems. And so for us to be able to focus on food, how does food actually fuel this? Like, what are the various vegetables that you can add into your diet for the medicinal properties to really activate these various organ systems? That's what we'll go through. And I love teaching and educating you on that. And then also we will use some supplements and vitamins as we need to. If we need to kickstart those systems, if there are certain things that are deficient, we'll study your genetics to see which things you may be deficient in naturally just because of what your genetic steps are telling us. We'll also look into those genetics to see how detoxifications may not be working properly in a certain way and how we can upregulate those. What are some of the things that you, as a very individual, very specific health plan, like what do you need to do? And then with functional neurology, I analyze various pathways in the brain to make sure that they're all working, wiring together, firing together, connecting as they need to be. And so with each and every one of my patients, we'll go through if you have any symptoms, if you have any health concerns, if you have any neurological things that you would like to be primed up just a little bit to work more optimally, like for example, you focus, memory, concentration, all of those things. Do we need to be more clicked into our daily life? How are conversations? Does it literally take a lot of energy out of you to have a conversation with somebody or to come up with words that you're supposed to say for a meeting? Those types of things we would need to cover and we need to address. If we need to do a few exercises, then we can. I'll give you specific functional neurology exercises to help with neuroplasticity. Neuroplasticity is how we are able to rewire and structure, connect various parts of the brain to make them work more optimally. And then with functional chiropractic, so those previous two things I'm able to do digitally on Zoom. So I do a lot of Zoom consultations, a lot of digital consultations, where I'm able to really just help us with, wherever you are, you don't have to come in to see me. So I actually do see patients from around the world, lots of international patients, and then lots of other patients from various states. And it's nice because I don't want you to have to wait until you can actually come and see me in the clinic to get started with your health plan. So that's great. But the functional chiropractic side of things, that's where I will need to see you in office. So I do have patients that will get started with functional chiropractic, functional medicine and functional neurology digitally, and then they fly in to see me and we'll do some very strategic structural changes that we need to have the patient here in office. Some of the things that I do that is a little bit outside of typical chiropractic is in just adjusting the spine itself is I love adjusting extremities, basically every single bone in your body. I'm going to assess how those joints are moving and functioning and making sure that they're moving well. If there's one single joint off, then there can be muscles that are turned off, different in activation that's coming up to the brain. How that fuels the brain is so crucial for us to have that optimal function throughout our entire body. It's a synergistic approach. And so I really go into a full depth of that, including like adjusting the ears, doing like sinus manipulation, mobilization of the valves and soft tissue mobilization, say in the abdominal region, helping bring the stomach down if it's sitting above the diaphragm, helping make sure that the diaphragm is functioning like it needs to and moving so that it can, have great breath work that goes in, opening up the ribs, making sure that those ribs are expanding like they need to so we get the oxygen to the brain. Maybe the cranial bones, like that's something too, because we know that the lymphatic system, it depends on that pumping action, like a tiny little tenth of a millimeter of movement or so between the sutures in the cranial bones, how crucial that is for your brain. It all ties together. It all plays a part. And so these are some of the various specialties that I have in addition to others. And so I just wanted to give a little introduction of myself. Dr. Leila Doolittle. Thank you.